and Wellness's digital press conference and COVID 19 conversation. Today we have with us the Minister of Health and Wellness, Dr. the Honorable Christopher Tufton. He's joined by the Chief Medical Officer of Jamaica, Dr. Jacqueline Biseso Mackenzie, as well as Ms. Fabia Lam, the Regional Director for the Northeast Regional Health Authority, covering the desk of the Permanent Secretary, as well as Dr. Michelle Hamilton, the Director of Lab Services in Jamaica, and Dr. Karen Webster Carr, who is the Principal Medical Officer and National Epidemiologist. We'll begin today's press briefing with the latest update on COVID 19 in Jamaica, and our minister will make those presentations.
Thank you very much, Stephen. Good evening to all in the room and those who are monitoring remotely. Thank you for joining us again at our regular digital press briefing around issues related to COVID-19, an update, and of course our COVID conversations where we seek to elaborate on some of the issues behind the issues, to generate public understanding of what we are up against and how we are responding, and your own role in response to COVID-19. There's a fair bit of information that will be covered, but we're going to try and do it as quickly as possible. The regular update, of course, but Dr. Hamilton will then give an update, a brief update on the lab and its activities related to COVID. Dr. Webster Carr on community surveillance, a very big part of the approach now, given that we're trying to live with COVID. And the CMO dealing with vulnerable groups and issues around vulnerable groups. And I'm going to close with just a very brief overview of the extraordinary circumstances that we now face in light of an election campaign and, of course, COVID, just to highlight that there is a protocol and what that will mean for a campaigning environment, which is, of course, very important to our democratic tradition, but from a very public health perspective, it certainly has implications for the risk profiling of COVID in our society. So giving a sort of public health perspective on that. So let me begin by, first of all, expressing on behalf of the ministry and its team members our sincere condolences to the passing of a medical intern, which most of Jamaica would have heard about by now, Dr. Yakeev Morris, who was stationed at the Anata Bay Hospital in the pediatric department. Dr. Morris unfortunately collapsed during his work and was not resuscitated and unfortunately has passed. We want to express our deepest condolences to his immediate family and friends, as well as to the staff of the Anata Bay Hospital and the wider medical fraternity. We have been, in keeping with our approach, as a public health team, started to provide grief counseling for the staff, and of course a team has been in touch with his family. We want to recognize Dr. Morris, a young intern, for his efforts, for the work that he has been doing, and the contribution, of course, to public health generally, and certainly in regards to the COVID pandemic, his own role in that respect. I've asked for a report on this issue, and we will have better particulars once a proper autopsy and investigation is carried out. But suffice to say that it is with regret that we recognize the passing and we celebrate his life and his contribution, particularly in the medical field. In terms of the current case numbers, I want to report again today that over the past 24 hours we've had six new samples testing positive for COVID-19 in the last 24 hours. The total number of confirmed COVID-19 cases in Jamaica stands now at 1,071. The newly confirmed cases are 1 female and 5 males, with ages ranging from 10 to 61 years. The cases were recorded in Kingston and St. Andrew, 3, St. Thomas 2, and St. Catherine. 3 cases are contacts of confirmed cases, and 3 cases are under investigation. In terms of recoveries, 1 additional case has recovered and been released from care. Total recoveries are now at 754, or 70.7% recovery rate. 62, or 5.8% of the patients were repatriated to their countries of origin. Active cases, we now have 241. That's 22.5% active cases currently under observation. There are 6 moderately ill patients, and there is 1 critically ill patient at this particular point in time. That's 1 critically ill and 6 moderately ill. The 1,071 cases are classified as follows. 388 are imported, 340 cases that are contacts of confirmed cases, 75 local transmission cases not epidemiologically linked, 236 related to the workplace cluster in St. Catherine, and 32 are under investigation. The gender classification, 55% are females, that's 591, or 55%, and 45%, that's 480, or 45% are males. The ages range from 2 months to 88 years. Testing continues, and Dr. Hamilton will comment more on that, but so far we have tested some 45,279 samples, with 44,126 being negative and 84 pending. In the last 24 hours, 354 new samples were tested. In terms of state and home quarantine, we have 6 persons of interest in being quarantined at government facilities, while some 26,239, that's 26,239, are in home quarantine. So, of course, the vast majority of Jamaicans are in home quarantine arrangements, and the lifting of restrictions that has become more of a standard procedure as opposed to institutional quarantining. That comes with advantages, but it also comes with risks, and I think those risks represent the importance of community surveillance, which Dr. Webster Carr will speak to later on. Community quarantining, currently there are 2 parishes with communities under quarantine. The country should be aware of this by now, in Clarendon and St. Thomas. Sandy Bay in Clarendon is under a 14-day quarantine, which took effect on Thursday, August 6, 2020 at 7 p.m. and will run until Thursday, August 20, 2020 at 6 a.m. In St. Thomas, the quarantine areas are Lower Summit, Church Corner, and Bamboo River. The quarantine restricts the movement of members of the communities in order to slow or prevent new exposure and hence new infections by further testing of members of the community, close monitoring of members of the community for development of symptoms, early containment of newly detected cases, prevention of new exposures and transmission of diseases, and education of members of the communities of infection prevention and control measures. So, just to deviate a bit from the script, it's so important that Jamaicans appreciate or understand why we have to engage in community quarantining. It really is about trying to cauterize a problem that has been detected based on surveillance in the field. We go into a community, we see a pattern, we observe a trend, we identify positive cases. There's a risk assessment that the cases may be more based on the contact tracing or the movement of persons in that area, in that vicinity. They went to church, they went to market, they went to visit friends, and based on that risk assessment, a determination is made that we have to bring to a halt movement in and around and within that community. And then the team goes in and does mass testing and questioning and all the things that are necessary to try to cauterize or to stop the spread of the virus. I dare say this is what has represented a big part of the success of Jamaica's approach to COVID. And it is inconvenient to those who are affected, but frankly speaking, it's the most effective way. So we crave the patience and indulgence of those who are affected. and we say thanks to those who are involved in the process. The parish health departments and our partners have been on the ground and continue medical surveillance, welfare, and public education, as well as pharmacy services through the National Health Fund. So we understand the restrictions come with implications for work, for access to some basic amenities, and of course the government provides support in a number of ways by allowing free time or days that you can go and do your shopping. The NHF comes in for medication, provide medication, and of course persons who cannot afford to shop in the zone, the Ministry of Labour comes in with welfare packages, and it's really a team approach, and it has worked. I mean, this is our 5th and 6th, or 6th and 7th, 5th and 6th probably, quarantining communities, or somewhere there. But we have done a few before. Summary of our efforts on Wednesday, August 12th, as it relates to the quarantine areas are as follows. Health team members on the ground in Clarendon, in Sandy Bay and its environs, 45, in St. Thomas, 51. Home visited, 445, St. Thomas, 3, that's 445 for Clarendon, 339 for St. Thomas. Persons interviewed, 1,026 in Clarendon, 354 in St. Thomas. Persons reached by the health education officer, 626 in Clarendon, 200 in St. Thomas. Samples collected, 285 in Clarendon, 371 in St. Thomas. Positive cases, 2 additional, and 20 in the case of St. Thomas. 2 additional in Clarendon, 20 in St. Thomas. And prescriptions filled by the NHF, 54 in Clarendon and 189 in St. Thomas. It's interesting to look at these numbers because it tells a deeper story around the status of those communities in terms of what is available, you know, the health profile and so on. That's for another conversation, but what this breakdown demonstrates is that the team is on the ground and they're working. This is not just an inconvenience. It is also a prescription for significant work on the ground, and that work continues. And again, we want to recognize the health team and the other agencies who are involved. I will comment on the issues around election campaign later on, but for now I want to just conclude by saying that no more than ever, it is so important that Jamaicans observe the protocols, remain vigilant. Most Jamaicans must appreciate that they must take personal responsibility to protect themselves, their loved ones, their community, and of course, by extension, the country. Observing the critical components of the protocol, wearing the masks, physical distancing of 6 feet, avoiding crowded areas, staying at home if that's what you are told to do, if you're under home quarantine, frequently washing and sanitizing hands and cleaning surfaces where droplets may have fallen, and obeying the quarantine and isolation orders as given by the Public Health Authority. You know, I was listening to one media house earlier this evening where there's a poll that says the public has confidence in for the most part, in the government's response to COVID. And a journalist actually contacted me, and while I expressed the view that while I really appreciate and thank the populace for their understanding on behalf of the thousands of public health workers who have been involved in this process, and the government and the private sector partners and the multilateral and bilateral partners, it's so important that we still appreciate the realities of COVID and that it is still with us. It's still a clear and present danger. As we say, the sort of vernacular or cliche, COVID's still a keep. It's not completed. And so everyone has a role to play, everyone counts. And it is very important, particularly now with over 26,000 Jamaicans being quarantined at home, having come into the country for the most part, that we observe the protocols, because otherwise we're going to see community outbreaks that we really don't want, or transmission. And we've seen some evidence of that. That is worrying. But I think we have it in us to pull back and to observe the signs. So we appreciate the confidence of the public. But it's so important that the public and all of us recognize that the work must continue. So that's it for me and the general update. I'm going to ask now for Dr. Hamilton to give a quick update on the lab and then we take it from there with Dr. Webster Carr on community surveillance. Dr. Hamilton.
Thank you. Good evening, everyone. I have two brief updates from the lab. One is to do with backlog testing, and the other is to do with private testing services. At this time, there is still a backlog at the National Laboratory Services. We were in fact on track for full clearance of this backlog, but we did not receive the reagents that we were expecting to complete the clearance of the backlog. The situation is not, however, one of doom and gloom, because we have been assured and documents have been forwarded to us to indicate that we are in fact getting a large shipment of kits next week for the Cobas 6800. And it is very good news indeed, because it means that we will have kits on hand to clear any samples remaining at the lab, as well as to deal with eventualities coming in from the field. So we did not get the kits we were expecting, but we are getting a large number of kits, a much larger number of kits, might I say, than we were originally expecting, just that it's occurring a little after the time that we had expected the kits to come in. So they are arriving. They should be here by latest Monday, and then we will be able to proceed. With respect to the testing with private labs, we have been in discussion with several labs. There was one that was particularly promising, but at this time, none of the labs have met the full requirements for the Ministry of Health for us to be able to offer testing services through these labs. There is a validation study that has to be conducted, and just to explain that this validation study helps us to determine whether or not the results obtained by the labs would be similar to the results we would obtain if we did the test ourselves. So it's to say, yes, you can test, but would the result that you obtain be the result that would be had if we had done the testing ourselves? And it is very important that this be done prior to giving endorsement of any services, because this is a means of ensuring that we provide accurate and also safe testing. So we have labs that are in discussion, and with one lab, as I said, very promising, very close, but we have to complete the validation study before, as a government, we could endorse the services of those labs. So it is really in the interest of the private labs to work along with us to complete whatever outstanding requirements there are, because we are aware that there is a large demand for their services. But we will have to wait until the process is complete before we are able to endorse the services of any laboratory. In the meantime, we are aware of the large demand, some for urgent travel, and so if things go as we expect, all things being equal, if our kits arrive in time and we are able to deal with the outstanding samples at the lab, as we expect to be able to do, then we will see if we can offer, we may be able to offer services to members of the public. But at this time, we are focusing on getting the kits in, clearing the samples that we have, and assessing what is coming in from the regions from our various surveillance activities. So we'll be assessing the situation to see if we can offer some services to the public. But with respect to endorsing the private labs, until they have completed the outstanding requirements, unfortunately, we cannot at this time endorse their testing. And again, let me emphasize, this is so that we can guarantee safe, accurate testing, which at the end of the day is what is really required by the Jamaican people. Thank you.
Thank you very much, Dr. Hamilton. And I'm going to ask you to just allow Dr. Webster-Carr, please, to quickly make her presentation. Don't leave, though, because just in case questions are required of you. Okay, great. So the word from Dr. Hamilton is that the process of completing, I don't know if you call it certification or validation of the private labs is still yet to be complete. And so the allowing, which actually was one particular lab. One of the things that we're going to have to deal with is labs advertising for testing, because I do know that in the public space there are labs that have been advertising as offering to do tests, and that could be a challenge if they are not validated. And we really don't want to send big signals, so that's something we'll have to look at. All right, Dr. Webster-Carr, are you ready to go? All right.
Yes, good evening, everybody. I'm going to present on what we have been seeing in surveillance, and what is being shown right now is what we call the epidemiology curve, and it looks at the onset of symptoms. So currently, initially we peaked around April 13th with the cases from the workplace cluster, and then by May 30th we had no cases at all. Since then there has been an increase with a peak around June 27th, thereabouts, really from imported and import-related cases. We did not have any local transmitted cases till about the 27th of June, date of onset. Since then, we have been having a little bit more local transmission cases and cases that are under investigation. We expect that some of these will turn out to be local transmission cases. So if we look at the next slide, it shows the cases, more recent cases, and it gives a better picture of what is happening currently. So initially, we were having more imported and import-related, and currently we are having both imported and local transmission cases. So we will now look at, so when we look at the active cases, there are about 8 clusters currently. So the diagram you see shows you the clusters that occur across the country. Many are in St. Thomas. St. Thomas has the largest cluster now, and you see a cluster in Clarendon, which is also, and there are interactions between parishes. So St. Catherine and Clarendon, St. Thomas, KSA, St. Catherine is shown there. We look at the deaths. This chart represents the deaths. This shows that persons, the 14 persons who died, they had one or more underlying condition or risk factors. And we're going to talk about how we do surveillance in the community. So we'll look at the slide that shows that so we go house to house to survey and to identify persons who may have symptoms. All persons who are symptomatic are to be swabbed. Then we look who is near to these or the place of interest. So all neighbors in the immediate vicinity would be swabbed, irrespective of having symptoms. And then we take it out a little bit, 100 meters from the place of interest. And we would do 1 in 10, irrespective of being having symptoms or not. And then when we go further out, we would do only persons who are symptomatic. If we are finding a lot of cases in these circles, we will go even further, 500 meters, depending on what we are finding. So this is how we go about doing the community surveillance. We have done 44 communities so far, and only 4 communities have been positive, with the lowest positivity rate being in Tivoli Gardens and the highest being in Church Corner, Bamboo River, Lower Summit area. The other positive communities were Hamilton Mountain and Sandy Bay communities. So Minister already told us about that, and so we will just say a little bit about some analysis we have just completed yesterday, as a matter of fact, which showed that when we compared the transmission from one person to another and compare it to the household members, persons traveling in the same vehicle are 3.5 times more likely to be infected and become ill than household members. So if you're in a vehicle with somebody who has COVID-19, you are 3.5 more likely than the person who lives at home with them. Non-household family members have a similar risk of being infected as the household members. Co-workers have a similar risk as household members, and healthcare workers are less likely than household members. So I think this is the presentation. Thank you.
Thank you very much, Dr. Repstakar, for that presentation. I'm sure persons may have a few questions after. The key here, of course, is that the work continues in the field, and there's a method to determining how we determine where to quarantine and who to test and the extent of the testing. So we appreciate that that overview. I think the public's understanding of this is very important, particularly those who are affected. All right, so we're going to move quickly now into the CMO's presentation, looking at it's titled here, Death and the Vulnerable Groups. I prefer to say vulnerable groups. CMO.
Thank you, Minister. Stephen, you can go to the first slide. So I just wanted to provide an update to the public about the recent deaths that we've had. A lot of questions have been asked about these persons, and in particular, persons are pretty concerned about the fact that we have a 37-year-old in this recent numbers. So we've had 4 recent deaths, and the age range of these persons are from 37 to 88 years. We've had 2 males and 2 females. Like the other cases that we've had before, these persons have had comorbid illnesses. We've had neurological disease in 1 person, diabetes mellitus in 2 persons, hypertension in 1 person, renal impairment in 2 persons, and heart disease in 1 person. So it is very important that we understand that the presence of a comorbid illness does put persons at risk. And again, we see featuring very, very prominently diabetes and renal impairment. And so we just want the public to pay attention to this, because persons who have these illnesses, we must protect them and they must protect themselves. For persons, go back, right. So, in terms of contact with visitors from overseas, 3 of the persons from our preliminary investigations have had contact with overseas visitors. Again, this speaks to the fact that we have persons who have conditions that make them vulnerable to a more severe illness, but yet there is this the continuous entertainment, mingling with persons that come from overseas. We have been speaking about this from a long time to say that, persons who are coming from overseas we've had quite a number of positive cases. Many persons are coming from areas where there is significant exposure to disease, and they themselves may not know that they have been exposed. They may not look like they have been exposed. They may not have any symptoms, but they may have infection on board, and they are able to transmit the disease to others. So sometimes it is not that the person looks sick, but if you have a comorbid illness, then you must stay away from persons who have the possibility of an exposure. We've also seen the risk of exposure with occupation for 2 of the persons that had passed. And Dr. Webster-Carr mentioned that persons who travel in a conveyance with someone who has COVID-19 has a 3.5 times more likelihood of getting COVID-19 than somebody that lives in the same house with them. Now, this is very important because we have to share this information. It's not that we want to share private issues, but, one of our recent deaths was in fact a taxi operator. And these persons have to understand that the risk that they face, as well as the persons who are traveling in these vehicles, and to make sure that they adhere to the precautions that have been put out there, that they must not go into an overcrowded vehicle, and they must make sure that they have on their mask. They must make sure that they travel with the windows open. I travel on the road and I'm still seeing taxis traveling with their windows up. And I'm still be able to look into some of these vehicles and recognize that persons are not traveling with masks on. Now, that 3.5 times more likelihood of catching the disease than somebody that is living in the same house with you is very, very significant. And it can result in, you don't know who it is that have COVID. They may show no symptoms. So the precautions must be taken with everyone. The other occupation that I need to speak about is that another of our persons that passed was a storekeeper or a shopkeeper. Now, this is also a situation where a lot of persons can come into your business place. You don't know who they are. You don't know if they have been exposed. You don't know if they have symptoms. But you deal with these persons. And we're not saying to stop the business. What we're saying is the precautions that have been put out must be adhered to. And they are to be adhered to for a reason, to prevent yourself from becoming infected and for preventing the persons that come into your business place from becoming infected. Therefore, we have asked that there be some method of hand washing or hand sanitizing when you come into business places. Business owners must provide this. Business owners should not allow persons to come into their business if they're not wearing a mask, especially if the business place is small and can get congested. They must not allow more than enough persons in the business place that you can allow for there to be distancing, 6 feet distancing between the persons if they're not wearing masks, or 3 feet distances if they are wearing masks and using all the other precautions. It is very, very important because you may think that, oh, I just have a little shop around the corner and it is not important. This is for big business place that you have somebody who is at the front door spraying you with alcohol or something. But no, this reaches down to the very, very small business. The same things apply. You must hand sanitize. People must wear their masks when they come into your business place, and they must maintain distancing, physical distance between one another. And they must come in, you serve them, and they get out quickly. The other things that I want to speak about in terms of the recent deaths that we had, having looked at the cases, then there are some areas for increased concern. In doing our community surveillance now, we're not just looking at fever and respiratory symptoms. We're also very, very cautious about gastrointestinal symptoms in elderly persons. And so therefore we are asking persons that if it is that persons are elderly and they have what looks like gastroenteritis, they're vomiting, they're having diarrhea, abdominal pain, then they should take them into the hospital for them to be checked. And there should be a very low threshold for the testing of these persons. And again, I bring to your attention again the increased risk associated with transportation. So those are 2 points that have come out of looking at the risk profile of the recent deaths that we would want the public to be especially cautious about. To look at comorbid illnesses, to say that this is something very, very real. We have been saying to persons to protect your relatives with comorbid illnesses, but we're also saying to the persons that have comorbid illnesses that they must take the necessary precautions. So I just want to summarize for that slide, Minister, and end on that slide. But there is, go on to the next slide, Stephen. There is another thing that I just want to speak briefly about, and that is about the quarantine. We have 2 areas that are presently under quarantine, and we are having issues with persons adhering to the quarantine restrictions. Persons find different ways to pass the security officers. They feel that it is their right to be able to go out and take up out of the quarantine area, take a bus or a taxi to somewhere else. They feel that they need to conduct their businesses, and so therefore they're going to find some way to do it. And they don't understand that they need to stick to the quarantine. Now, both areas that are under quarantine, we have had a significant number of positive cases in those areas. We have had a number of positive cases that have led to us putting the area under quarantine. And since the areas have been under quarantine, we have been testing within the areas, and we are still getting positive tests. And we're still doing surveillance on the ground, and we're still seeing symptomatic persons. It means that transmission is still going on in those communities, and the only way that we are going to stop it is for persons to stay in their homes. Next slide for me, Stephen. Now, anybody can have COVID, and there are a range of symptoms that persons will have. We have mentioned some fever, respiratory symptoms, or, as I mentioned, gastrointestinal symptoms, especially in the elderly persons. But if you are exposed, and right now everybody in one of these quarantine communities must consider themselves to be exposed, because there are so many positive persons that are within your community. So if you are exposed, the virus may have entered your body, and you may or may not be infected. Now, you will not know if the virus is there right away, and you may never know at all. But the virus, once it is in your body, it will multiply, and you may start to have symptoms. And you can pass it on to others even before you know you have it. Wearing a mask prevents the virus from traveling far because it is trapped within the mask. Washing your hands and wiping off surfaces kills the virus and it decreases the chance of you spreading it. Now, quarantine means that you stay at home for 14 days after a possible exposure to the virus. And if you do this, you can prevent others from catching COVID-19 from you. You will protect your family and friends from getting it. Some of them have conditions that will make them have a more severe illness than you possibly could. Next. Now, if everyone who has been exposed to the virus stay home for 14 days, then we can stop the transmission of COVID-19. That means that we can stop the transmission of COVID-19 in Jamaica. It is a possibility if everybody who has been exposed just stay in their homes. Now, if you are in quarantine and you develop symptoms, then you must be tested and go into isolation to prevent infection of others. SARS coronavirus 2 does not live forever in you. For most persons, the body will kill the virus and you will be virus-free after a few days. Staying home for 14 days after developing symptoms reduces the chance of spreading the virus to others and thus stopping the virus right in its track. We can stop the transmission if persons just stay at home, whether they have been exposed or whether they have a positive test or they have symptoms. This is how Jamaica we can stop COVID-19. We can stop it. You need to stay home and use all the necessary precautions to prevent transmission. Thank you.
Emphasized and re-emphasized, and I, as I said, those who have ears to hear, let them hear. We will continue to emphasize the message, but really, we want Jamaicans to appreciate why they need to follow up and observe the protocols. It's absolutely critical, particularly in these times when the posture is to gradually restore normality, focus more on home quarantining, and it means self-regulating or observing the protocols. Otherwise, we're going to have difficulties. And whether it's the government, the health ministry, or others, we can do so much and no more, put it that way. And the evidence is supporting that when we look at the profile of those who have passed, late presentation, not observing some of the protocols, and so on. So it's very key. I want to just spend 2 minutes before the questions to mention the fact that we have the extraordinary situation of a general election announced by the Prime Minister recently. A nomination, of course, being on the 18th of this month, Tuesday, next, an election on September 3rd. The tradition, of course, with elections are known for those who have been around, at least for one. Campaigning, and festive, movement, crowds, all the things that have literally become a part of the culture and a part of the democratic tradition, which we don't want to discourage. But in the case of COVID, it means there are implications. There are implications because there are protocols around crowd movement, crowd control, sanitization, the wearing of the masks. There are existing protocols. Those protocols will be adjusted and reflect some of the issues around the election campaigning and on election day. Now, the Ministry of Health, of course, is a non-political entity. As government, we serve all of Jamaica, and I think we recognize the responsibility that we have. I'm the only politician in the room, but as minister, I am for all Jamaica. There's a time and place for my own political choice and campaigning. The public health perspective around the campaigning is what we want to emphasize here. It's so important that we recognize that there is going to have to be a protocol around the campaigning and election day. The ministry has given its own technical advice, working with the Electoral Commission as it relates to election day, And those protocols would have come out of the Electoral Commission, and we've heard those being discussed. And I'm sure they're going to be mass produced and distributed, and the political parties and others will educate, inform, and follow those guidelines. We, from the ministry's perspective, has a public health interest in ensuring that they are followed, because after the fact, we don't want to be picking up the pieces with mass spread of COVID and all the implications that those represent. So that's one, the election day activity. The other is the campaign activity, starting with nomination day onto election day. And we have assisted in terms of the technical specifications around what would be the guidelines for campaigning. Those have been discussed with both political parties, or the main political parties. Not actually, there are two others that were in the room with the political ombudsman, and the Office of the Political Ombudsman is the entity that will ultimately disseminate an agreed position around political campaigning as it relates to the public health going concern, even though the ministry has provided some technical advice on the issue. And you will see and hear more around that as it is made available and public through the Office of the Political Ombudsman. But there are some critical elements that are not dissimilar to what the protocols are now, except they are specific to the campaigning. So the issues of mask wearing and sanitization and 6 feet distancing are standard protocols that will continue and will remain in effect. Nomination day is a special day in the political cycle. There are going to be some specific guidelines around that in terms of the numbers, and the Ombudsman's office will outline that. Then there is the house-to-house campaigning, getting the voters to support or to discuss your choice of candidates. And there are some restrictions as it relates to the numbers. I think the protocol says 5, no more than 2 to enter a home. Of course, the wearing of masks, very standard, sanitization standard, not to congregate if you have symptoms, if you're coughing or sneezing, not to stay in one space beyond a certain time. The proposal is 15 minutes. So you won't see the traditional large mass gatherings with big stages and long hours of, political speeches and so on in a typical form, because there are public health concerns around that, and the government has bought into that. And the discussions too with the opposition parties have similarly so bought into the need for those concerns. So I raise it from a Ministry of Health, public health perspective, to say that the country should be aware and make themselves aware of what the specifics of these protocols are and comply with them in the interest of public health and safety. It's not an attempt at dampening the political climate. It really is an attempt at ensuring that COVID is contained and the risks are minimized. And again, the campaign protocol will be put out in the public space through the Office of the Political Ombudsman and, of course, signed off by the political organization. So we encourage that. We in public health will be out there. The team, I'm sure, as they have always been in terms of surveillance, in terms of addressing any concerns that are raised, and the system will respond appropriately depending on an assessment of that risk. And that is something that we will prepare for and be most vigilant about, because we understand that there are going to be temptations to mingle, and the risk around that would be a challenge. We may have some other additional announcements in the coming days from a public health perspective in terms of how we will treat with this extraordinary circumstance to minimize, again, the risk of COVID. So place it on the agenda for whatever it's worth. And I'll hand over to Stephen to maneuver or manage the questions.
Thank you very much, Minister. Just reminding our colleagues on the Zoom, the media colleagues on Zoom, to use the raised hand feature and just wait to be acknowledged. And you can go ahead with your questions related to COVID-19. We're going to go to Janet Silvera.
Thank you. Good evening. I have three questions. One is in relation to St. James being named the second highest, having the second highest active cases in the country, with 64 active cases at this time. I would like to find out why there has not been a lockdown for St. James or a quarantine for the parish of St. James, but there has been for St. Thomas and even the area in Clarendon, which is much smaller. The only other place with more active cases would be St. Thomas. And the next question is the attractions. When will the tourists be allowed access to the Jamaican attractions that have been waiting to accommodate them? And number three, I understand that there's a split. This tourists who usually book two different hotels, for instance, a beach vacation and somewhere else, they're now being told that they can only stay in one property, and even after they have completed their stay in that property, they cannot go to the other property that they've also booked. So those are my three questions.
As the same to address the questions.
All right. So first of all, let me start with the last question in terms of the stay in resilient corridor order. So the order has always indicated one address that persons are to stay at, and the address is placed on the order, and the person that is visiting signs the order. Now, the order states that they are to stay on property at that address that is recorded. So in terms of the legal framework for that, that is what it is. Now, in terms of a public health reasoning as to why it is that we would want this to happen, now, we understand that we have to continue this economic activity. However, it is not without risk. It is not without risk to the general population. And so therefore, we want to, our whole management of this pandemic is about restriction on movement, to limit movement between different sets of persons, so that especially high-risk persons with persons of lower risk. So we would want to ensure that the tourists stay on property, and they stay on one property, and afterwards they leave, they go to the airport, and they depart. We would not be supporting the movement of the tourists around several properties, because there is the risk of exposure to more members of the population and the risk of infection, the risk of severe illness among persons.
So I'll just looking on St. James, when we look at the active cases, St. James would have, this is up to yesterday's figures, it doesn't include today's figures, have 35 active cases. However, all but one is import or import related. And so the action is not necessarily the same as a parish or community that would have local transmission that are not epidemic. So these are cases that pop up at some time and says something is happening in the community because we can't link them. So the ones that are happening in St. James, are active in St. James currently, are import and import related. Only one is not.
Just to add to that, and also one of the reasons that we would, the amendment to the order number 11 would have shown that we have increased the restrictions on the business travelers, where the business traveler coming from high-risk areas are now required to pre-test, and by the 20th of August, they will have to present, when they present at the airport, their authorization would have to indicate that a pre-test was done, and they would also be tested on arrival. And the reason for this comes right back to what Dr. Webster Carr has been spoke about in terms of the cases in St. James and other cases across the island, where we are seeing that large numbers of workers that are coming in under the business application have been positive. Now, these persons, we have several groups of those persons in St. James. They have been isolated, and so therefore, and they have been isolated from they came into country. So these persons would have gotten a quarantine order that they would have to remain in quarantine until they get their result. And as soon as they've gotten the result, that would have been changed to isolation. So these persons have really been kept away from the population, different from in the community setting, where we pick up the local cases usually when they start having symptoms, and there is usually transmission already in the communities.
Thank you very much, Simon, Dr. Webster Carr. I'm going to go to Brittany Clark.
Hello, good evening, everyone. So I have two questions. Are you hearing me clearly?
Yes, go ahead, please.
Okay, so the first one, is it possible for the ministry to give us the number of samples that are in the backlog currently, and how far back do these samples date? Just to get an idea of how long persons are waiting on their results. And secondly, it was mentioned earlier by Dr. Hamilton, I believe, that none of the private labs has met the full requirements of the health ministry to facilitate COVID-19 testing. So is it that those labs offering tests, is it that labs are allowed to offer tests, it's just that it's not endorsed, or is there a potential of any breach being or violation of any protocol in that case? Thank you very much.
With respect to the backlog samples, at the last briefing, I had indicated that we had split into two sets of testings. So we had some samples that were in a backlog, and we had samples moving forward from at the time we had said the 25th, but we have actually been able to be current now from the 22nd of July to date. So the samples in the backlog would be samples from July, approximately the middle of July, until the that would have been the 22nd of July. So those are the samples that are in the backlog, because we understood that we needed to be current with samples that were coming in so that we could keep abreast of what was happening. So we made a decision to have a cutoff point, and we have stuck to that decision. So it is samples that would be between the middle of July to the backlog, approximately at the 22nd, that we'll be focusing on at this time. So the samples that are to be tested are all from July. With respect to the private labs, as we have said before, it is very important for us to be able to give a guarantee as to what is happening at each of the laboratories that offers tests. The laboratories have not fully met the requirements, and so we cannot endorse what they are doing at this time, because until the requirements are met, we would not be in a position to guarantee the accuracy and the safety of the operations. It is now a matter for us to consider if these laboratories do not speedily meet the requirements, what, if any, actions would have to be taken. given the significance of COVID-19 infection to public health.
Thank you very much, Dr. Hamilton. We're going to go to Emma Lewis.
Yes, good evening. For Minister Tufton, I want to quickly go back to the election protocols. Have they been signed off on now? Are they official and approved by all the parties? And will they be posted somewhere online? And I also wanted to ask, those who are in home quarantine can actually go out and vote on election day, am I correct? Whether they have received their test results or not. And I'm just checking on this, I'm just asking if that is correct. And what about arrangements that are made for people who've actually tested positive to cast their vote? I don't, not quite clear about that. Thank you.
Okay, thank you very much. Just let me take the first one, and then I'm going to leave CMO in the hot seat to take the other two. The election protocols were discussed at the level of the Office of the Political Ombudsman. I was present. The General Secretary of both parties, Minister Chang and Julian Robinson on the PNP side, as well as the opposition spokesperson on health, Maurice Guy, as well as two other parties being represented. I'm sorry I don't have the name of the other political organizations, but they were represented. The discussion did take place, and there was general consensus or agreement around the elements of the protocol. There may have been one change, I think, suggested and signed off on at that level. I don't want to get into the specifics of it, except to say in general terms, yes, there was general agreement, and that's why I say the final document really ought to come from the Office of the Political Ombudsman, but it has involved the discussions with the other political entities, certainly the two main political parties and two others. On the issue of the quarantine and positive case, CMO, you want to comment on that?
Right. I think foremost in going through this election, we still have to remember that we are in a pandemic and that this is a public health emergency. We are, of course, this is new to us. In terms of the planning for how it is that we operate, we are looking at the experiences of other countries, how they have handled this situation. Our discussions right now are looking at the allowing of persons who are in quarantine to vote, ensuring that all precautions are adhered to. And so we are looking at some guidelines for those precautions in terms of the person that is in quarantine. We also have to look at the communities that are in quarantine to see what are the guidelines, and we have to work with the electoral office to see how communities in quarantine voting can be facilitated in terms of their safe movement. And what we're really hoping is that we have not started the discussions, and so I really don't want to go beyond what it's not in our jurisdiction to speak about. But we are looking in terms of how it is that can be facilitated. And so we have to have some discussion very shortly about that. Now, in terms of persons in isolation, now we just have a little bit over 200 active cases of COVID-19. Many of them are in hospital. Many of them are in facilities, government or state facilities, and there are some of them that are in home isolation. I would want to say that a person that is in isolation is a person that is a threat to public health. And so therefore, for us to allow that person to leave their facility of isolation and to go into the public knowingly as a public health team, that would be very unwise. And so we have to have some discussions about this, but I mean, this is a public health threat. And I think, first of all, that's the first thing that must be prominent in everybody's mind. And therefore, we are not going to be putting the public health at risk. Certainly not knowingly and not willingly to allow persons in isolation to vote.
So just to say on that, that the concern there is the public health safety. Just imagine someone who is positive, confirmed positive, and turning up at a facility and displaying symptoms. I mean, that could really compromise the democratic process. Certainly, and the optics alone of it would be that persons would be scared. Others would be scared to be around that individual and may themselves be deprived of participating in the process. So it's a serious concern. I know it has been said in other quarters that they are going to be or should be allowed. As the CMO says, there's some discussions will have to take place on that, but I'm certainly concerned and convinced as the Minister of Health that it would be difficult and would be risky or too risky to allow persons. And the truth is, any contagious disease, whether it's COVID or anything else, in these cases, persons would have to be restricted from participating in that kind of process. And there are segments of the population that don't participate in the process. I mean, persons who are incarcerated and so on. So it's not unusual to have parts of the population, depending on particular circumstances, that are not allowed that opportunity. So I think we have to clarify that by having conversations with the other critical stakeholders, and that will be done in short order.
Thank you very much, Minister. Thank you, CMO. We're going to go to Jamaica Social.
Good evening, folks. I'm Cassius Watson for Jamaica Social. I have two questions, one for the Minister and one for the CMO. The Minister, the CMO says that people are being infected by foreigners, and that's quite obvious, judging from what we are seeing with community spread and what we've seen happening in a few of the churches mentioned earlier, a week or so ago. How it's obvious that the 20-odd plus thousand people are just not staying home. I've heard clearly, it's almost a joke, a running joke, that people, we just leave our phones with our families or whatever, and we step out and we do what we want to. So people are not staying home. Isn't it just a matter of time? It's like trying to plug a dam. It's a matter of time before so many cases coming in and bringing this virus in. At what point are you going to seriously look at those risk areas such as Florida, and we know them, these lists, of just not allowing them in for a period? That's one question. The other is, we already said that people are already saying that they're really scared about voting on election day. The fact that they know that these lines are going to be long and they're going to be standing, and you're going to be standing with people, even with hoping that the social distancing is adhered to. You're literally going to be exposed around hundreds of people for a very extended period of time. Many people have work, many people have other things to do. Is there any consideration of any other alternate or alternative where voting is concerned, that maybe online, maybe somewhere else, that or some special way that people can go about voting? I'm curious to get that response from the Minister. Thanks.
Okay, so I think maybe those two questions I'll have to address. I would want to put the CMO in the position to be asking about voting online, but But the first issue of the risk profiling, because that's really what it is. The further easing of restrictions, allowing more persons to come in, focusing more on home quarantining as opposed to institutional quarantining where you have much better control, does change the risk profile of the virus and the potential for spread. It does place a lot more of the responsibility or the burden, if you will, on persons who are affected, those who are coming in, to regulate, to follow instructions. And, you know, there's no foolproof system. Persons will always find ways to get around a system. And as Jamaicans, the truth is we're good at that in a number of cases or situations. So it does really depend on how we comply and collaborate and coordinate with each other. Now, the Prime Minister has been very clear that if the risk associated with the decisions taken by government to allow freer movement becomes too high, and that is evidenced, of course, by spread and the extent to which we see spread, then the option of pulling back would be a real one. The pulling back could mean many things. It could mean restrictions on travel, as you have pointed out. It could mean suspending some of the privileges that were once allowed, and Minister Mackenzie announced some of those this past week in terms of beaches and so on. So you know, we're going to have to use the levers that allows changes in the protocol to make a determination, to be influenced by the risks. And so today, the simple answer to your question is if we have to, we will. And I think we've been clear on that. What we certainly would encourage Jamaicans to do is to follow the rules, follow the protocols so that we don't have to, because there are clear advantages to persons being allowed to go to work, to travel, to do all the things that they have grown up to expect to do and that are important to their livelihood and to the quality of their lives. So it continues to be assessed and decisions will be taken accordingly. As it relates to the second question around voting, and I think what you have done is described the traditional approach to voting. You know, the crowds, the long waits, the long lines, the closeness of persons who are waiting. And this is why I had said to you that the protocols that have been established for election day would attempt to not have those circumstances from playing out. So, you know, I can see, again, the Electoral Commission will outline those where persons of a certain age cohort who are vulnerable would be given some priority to vote, so they may have a separate line for them. The markers is contained in the protocol, so the lines are not doesn't allow such closeness. I can see the political organizations, since I'm the politician in the room, doing some creative things also to keep their voters engaged and comfortable, putting up tents and chairs and spacing them out and all of that sort of stuff. And those are all going to be based on the competitive nature of the politics and the fact that persons have a vested interest in ensuring that persons turn up and stay and protect themselves, because Jamaicans would naturally be concerned about some of the traditional activities in a traditional campaign in light of the protocol period. So I would say that you will see many differences based on the protocol that exists, but also you may see some additional creative approaches based on the competitive spirit of the politics and the need to ensure that your voters come out and participate. And I have confidence in the system that it can work, but I'd still encourage all of us to ensure that it does, because it really depends on us.
Thank you very much, Minister. There's a question from Krista Campbell from TVJ. She's asking you to address if any plans are in place to address issues of stigma within quarantine zones from members of the security forces. There have been complaints from residents in St. Thomas that they are being stigmatized by soldiers and police.
I don't know. I understand the stigma associated with quarantining a community or with an individual who may be suspected of or is confirmed to be positive. And we have been at length, we have gone to extreme to outline that, it is wrong and persons should be treated, equally, and, communities or individuals should not be stigmatized or discriminated against. And that's a message that we will have to continue to portray. I've been in both the communities and I've said that publicly. I don't understand the stigma claim against the police or the soldiers. I know they have a duty to maintain order guided by the protocols, which includes preventing movement unless allowed during the particular times that are prescribed. Now, if that is being interpreted as discrimination or stigma, then it really is not. We will investigate. I mean, we'll dialogue and see. But I think the responsibilities that they have are of such that one could feel restricted, because that's what it's all about. I hope that's not what is being interpreted as stigma. I've been there and I've seen them at work, and I think they have acted very professionally. But if there is a particular case, they can express the concern to the public health team on the ground, and if we need to elevate it, we will. But I have not seen evidence of that, to be totally frank.
Thank you, Minister. She's also asking you to address complaints from residents who are saying they're talking about the inadequacies of the care packages delivered to the quarantine zones. Items for persons with infants, such as diapers, and persons who may be allergic to tin food, seem to have not been considered.
All right. So the approach to care packages, the care packages are distributed by the Ministry of Labour, Social Security, Welfare, and I've seen the packages, and they're quite hefty. Put it that way. They are supposed to be able to feed a family of 4 for a week, I think, or certainly 4 or 5 days. Yes, there's a lot of tin stuff because it has to be preserved. I think they do make some special arrangement where persons have particular needs, and it's just to outline what those particular needs are. And I've seen diapers and so on in the storeroom. So maybe what that person needs to do is to make a particular arrangement. Remember now, this is not a gourmet provider, so don't make the arrangements or the requests too sophisticated, because it's not intended to be at that level. But I think they have been fairly responsive on persons who are in need, and genuinely so, because they go to a registration process. So they actually ask questions, fill out a form, do an assessment, and then follow up. It's not intended to support everybody in the community. It's intended to support those who are vulnerable. And if they make special requests, then I think those requests could be honored based on the assessment. But that assessment has to take place.
All right. Thank you very much.
Right. So our health educators or community health aides are within the communities. We also have a post there in the communities, and so therefore, if there are concerns about persons who have special needs, we ask you to communicate with the team members so that we can address them. We are making every effort. We do understand that there are persons with special needs, and so we are making every effort to try to fill those needs, but we do understand that we would not be able to do everything that would be requested, and we do provide some days that you are able to go out to the shops in the communities. What we would encourage is for the shops within the communities to stock on the stock days, so that they are able to provide to persons those other needs that we may not be able to meet. But as far as possible, we will try to accommodate persons with special needs.
Thank you very much, CMO. Thank you, Minister. And thanks to all our media colleagues for their questions during this COVID-19 conversation. I'm going to hand over to the Minister, who will give his closing remarks.
Thank you very much, Steve, and thanks to the well-informed ladies at the head table. I feel privileged to be among such significant capacity. I don't know what I'd do without the support. Thanks to the CMO and the head of our lab services, the head of our epidemiology unit, and of course, Fable Lam, who is our regional director acting for the PS, who will be back next week, I'm told, right? Taking his well-deserved break. And then after that, probably I can take some break, right, for other activities. Again, I want to thank those who have come online and listened and those who have asked questions, and we continue to provide this forum, this approach to giving updates, but also seeking to discuss and explain and get an understanding of the COVID response. I want to just say that it's not a perfect process. There's always going to be room for improvement, and we've never ever felt that we were doing everything in a manner that is flawless. Remember, COVID-19 is still a novel virus that is 6, 7 months, 8 months old probably, in terms of the recognition it has received and the name that it has received from the World Health Organization. It still represents, a learning curve that we're going through. But frankly speaking, the discussion around how effective the team and the society has done towards the COVID response should recognize that the significant efforts of the persons who have been involved at all levels of the society. I mean, I would never claim or take credit solely, and I don't think anybody in this room, even though we have all been very important to the process, could claim sole credit for what has happened in terms of the response so far. I think the 17,000 or so public health workers or healthcare heroes in contact tracing, public health team at the primary level, the collaboration with WHO, PAHO, the private sector, and of course the government of the day through the cabinet and the cabinet subcommittee on COVID led by the Prime Minister. The opposition through the Special Select Committee of Parliament, which has met several times to discuss the issue. And I just like to say to those who may want to feel that it is the season to be critical, because we are going into that season when, persons must express themselves. I mean, it's part of the competitive process, that we be careful not to discourage or take away from the hard efforts of so many persons who have, frankly speaking, up to this point, worked diligently to keep our population safe from COVID. The numbers speak for themselves. In terms of deaths per million, we are in the top tier in the Americas, doing a lot better than many other countries, and we certainly encourage other countries and hope that they do well. In terms of hospitalization, in terms of our contact tracing and the effectiveness of that. And so, it's not, I hear things about being a PR exercise and, we have somehow fooled the Jamaican people into thinking that this is not what it appears to be. And I want to categorically reject that on behalf of the hard-working individuals, agencies, organizations, and public health. And it, frankly speaking, is an insult to their efforts for anyone to suggest, to insinuate, to explicitly say that somehow we as a team and all the stakeholders involved are somehow trying to PR our way through this process. I don't know when since PR has been a bad word. The fact is, a big part of our problem in the past is that we have not kept Jamaicans informed, and we leave things up to speculation. I am proud of the fact, very proud as a minister, and this may be my last ministerial speech, so please indulge me, folks. The cycle is on, right? But I am very proud as Minister of Health to have led this team. Very proud to be a part of a ministry that has been responsive, not perfect, but responsive, accepted when there are errors, corrected those errors, and frankly speaking, that has driven the public's perception around issues that represents a risk in order to drive behavior. Because I say to people, public health is not just about the clinical prescription. You could be as bright as ever from a clinical perspective. But if persons don't believe in what you say or do, if they are not going to be motivated to act. Everybody knows that excessive alcohol causes them harm, or tobacco consumption, or excess sugar and fats. Every time you go to the doctor will tell you about obesity and its impact and why you must cut back on this and cut back on that. It's not because we don't know why we don't do it. It's because for one reason or the other, our culture, our behavior, our perception drives us to do otherwise. I'm a social scientist, not a medical doctor. And I challenge any clinician or anyone else for that matter to think that the clinical prescription will suffice. That's why we have 4 billion persons in the world of the 7.8 billion that are suffering from an NCD, a non-communicable disease, which is termed a lifestyle disease. We have to change our behavior, and our behavior is driven by social sciences, by behavioral economics principles, not just by clinical prescriptions and clinical diagnosis. And what this ministry has done, and the team in the ministry, and we have been criticized for it, we're experiencing now distractions of all kinds as to whether or not we have provided value for money in whatever the events are. The truth is, what this team has done, we have combined the clinical formula and capacities that we have, and we are good at what we do as doctors and nurses, lab techs and otherwise, with driving public perception to facilitate understanding and to drive behavioral change. And I make absolutely no apologies for that. And I think that is the way of the future. So I say thanks to them, credit to them, and let the work continue, and let us engage all on board. And let's not use this season to damage, to destroy what, frankly speaking, has been a good thing for the people of Jamaica. Thank you very much, and the conversation will continue in the weeks to come. Thank you.
Hello? 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 Yeah, you. Hold on, and a pandemic winner. You're now wearing a mask, you're now washing your hand, and you now keep the required 6 feet distancing from other people. And what could I really cause you? You need to stop it. That no mask, no wash, and no distance something there, nah keep. You know what keep? COVID-19. Yeah, it not gone nowhere. COVID-19, they are same way. So here what you are going to do for all of we. Wear your mask, wash or sanitize your hands pan a regular, and yeah, keep your distance, please. And thanks.